software involved in Reddit.
This is a thank Alps Innovation Group, Sharat Khanwala, who is our TiE charter member. Please give him a big hand. Nice meeting, nice arrangement, and thank you so much. The service has been great. So this is our first event in Carlsbad, and the facilities are beautiful. Everything is great. Food is great. So thank you for all that. I just wanted to give you an introduction to TiE, who we are. TiE was founded in 1992 by successful entrepreneurs in Silicon Valley. And then TiE expanded nationally here in US and then internationally. So today, TiE has 62 chapters worldwide in 17 countries. The Economist magazine has rated TiE as world's largest entrepreneurial organization. I'm president of TiE South Coast. A couple of years ago, we combined the two chapters between Orange County and San Diego, and we now call it TiE South Coast. And we have representation from Orange County also. Where is Orange County? Raise your hand. There it is. Okay, thank you. And we also have combined some of our programs with SAPI. SAPI is a physicians organization. As you know, there is a tectonic shift happening in healthcare and medical, and I think tech is playing a big role. So we have combined our efforts between SAPI and TiE. So we have brought some programs which are joint programs between SAPI and TiE. And the other key unique things that we offer in TiE is our young entrepreneur program. We call it TiE. TiE is, we take a group of high school students. They have some good ideas, and we teach them to be entrepreneurs. They are being taught by Dr. Rob Fuller at Rady School of Business. Dr. Rob Fuller is the Director of Innovation. And then they prepare their ideas into a business plan. That business plan is presented to a set of judges who are either VCs or investors. And they win prizes at San Diego level, at regional level, at national level, and international level. So, and we have mentors to help them go through this process. We have started this program this year, and I think we'll be finishing this program end of April. The other thing that we do is to promote entrepreneurship. We bring leading edge technology programs. For example, today's program is on augmented and virtual reality and its applications. And Barry Sandrew will talk more about it, but that's the kind of programs we bring. Our next program is going to be on incubators and accelerators. And the dilemma that entrepreneurs these days have is, they want to find out which way to go, where they can get good capital, where they can get good mentoring. So we'll have representatives from incubators and accelerators, and also successful entrepreneurs who have graduated through this program. So we'll have that. And the next program after that we'll have on self-driving and connected cars. This is a huge subject, and we'll have that in May. And then we have a series of programs lined up. So there are very exciting programs we've lined up for this year. And the other thing that I wanted to note here was this being our first event in Carlsbad, North County, we invited a chief guest to our program, Carl Morgan, who is president of North County Economic Development Council. I'll ask Carl to say a few words.
Hi, good evening. I know that you didn't come here to talk to me, but they'd asked me to come in. And hey, welcome to North County. We are 26 cities and unincorporated communities. We are 500,000 jobs, and we are 1.2 million people. Big area, a lot of really cool stuff. I'm the CEO of the San Diego North Economic Development Council. We have two 501c, a 3 and a 6, and what we focus in on is advocacy, legislation, education on the 6 side, and then on community-driven initiatives and programs. We do an economic summit and we track our key industry clusters, of which you have in front of you from our recent economic summit a brochure that shows you all the detail and data on our last economic summit. So the territory that we serve, oops, that's the map. So that's the 26 cities and unincorporated communities. And then, essentially we are about job creation, business retention, working with the business community, making sure that the talent and skill sets from the educators is matching the need of our business community as our key industry clusters grow. And when you look in the brochure that's on your table, you'll see that connected tourism is our largest, healthcare is our second largest at 36,800 employees. And then of course, one that's probably near and dear to your heart is also the biotech, biomedical delivery devices and the robotics and some of the other things that we talked about a few minutes ago. We're really all about, working for the business community, promoting jobs, creating new economic development in North County. It's really great to see all of you here today. I'm sure I'm going to be blown away by what I see, and I was told that you guys are in a really tight time frame. So what I'd say is, look us up on our website, take a look at the data that's there, explore our North County EDC website and also our San Diego North EDC Council website. And if there's anything that I can ever do to help you out as a business, all you have to do is pick up the phone and give me a call. Thank you so much and have a great evening.
Thanks, Carl. I also want to thank our, one of the things that we have in TiE is our charter members. Charter members are our pillars. Charter members are folks who are part of TiE and they are successful entrepreneurs. They are folks who give back to the community of entrepreneurs, and they provide guidance, mentorship, and things like that. The other group of folks that I would like to thank is our executive committee. And this executive committee has done an amazing job. I think we couldn't bring this type of programs, and these are all volunteers, and everybody, most of the folks in TiE is a volunteer, and they bring amazing programs. So I want to thank executive committee members. Please stand up, executive committee members. Thank you. Next, without taking much time, I would like to hand over to Dr. Barry Sandrew. As you all know, Dr. Sandrew has been a serial entrepreneur. He has brought a lot of technologies here, created a lot of jobs. Here is Dr. Sandrew.
Thanks, sir. Well, thanks for coming, everybody, and I'm so glad that the bar is still over there if anybody wants to drink. Don't be shy. I thought today, for virtual reality, augmented reality, we mix things up a little bit. We have a lot of people in the audience that are interested in medical apps. And I know that a lot of people have been to some of my other talks on the entertainment industry, and in particular 3D, but I'm going to give a discussion on basically where virtual reality and augmented reality are, from my perspective, of 30 years in the entertainment industry. So the first thing I want to do is introduce our medical panel. Dr. Ariel Ortiz. He came in from Mexico this afternoon. Dr. Ortiz is a world-famous weight loss surgeon, director of Obesity Control Center and highly acclaimed Ariel Center for Cosmetic Surgery. A pioneer in his field, he is credited with many of the modern techniques in use around the world today. He has performed over 16,000 weight loss surgery procedures on patients from every continent and has similarly performed surgery in every corner of the world. He has trained and proctored hundreds of surgeons in America, Europe, and Asia, and is a director of the Advanced Weight Loss Surgery Training Facility. Dr. Ortiz has helped develop many of the game changers in weight loss, including the lap band system, where he proctored hundreds of surgeons globally and developed a surgical technique as well as the follow-up program. So he's going to be discussing some work he's done in terms of 360 virtual reality surgical, basically continuing medical education type work. And along with him is Jurgen Sandrew, who he and I go way back. In fact, I taught him how to talk. And Jared is a visual effects and stereographic supervisor, which is a very significant part of the visual effects industry, especially when it comes to 3D. And he's been doing that for probably 10, 12 years. And 6 years ago, he joined me at Legend 3D, and he basically was instrumental in building the entire pipeline for getting some of these feature films done. Today, he's representing Virtual, which is a company that worked with Dr. Ortiz on the 360, the virtual reality stuff. How many people had a chance to see it outside? Oh, good. Very, very impressive stuff. And Matt Dijon was supposed to be here. He also was part of Legend 3D. He was a visual effects and stereographic supervisor with Jerry. And worked under Jerry. Jerry was chief creative officer working with him. But unfortunately, he had to do a shoot on the East Coast, so he couldn't make it, so Jared is standing in for him right now. So what I'd like to do is first introduce Dr. Ortiz.
Working beautiful. I would be terrible in a technology meeting. All right, well, thank you for the invitation. This is going to be a short 57-slide talk. I think my introduction was worse than the whole slide thing. A couple of things I do want to call your attention to. I am a bariatric surgeon, a weight loss surgeon, but sometimes in medicine, I think we're so full of ourselves. How many doctors in here? All right, I'm glad. We're so full of ourselves that we don't see ourselves. We think we really know it all, and there's so much stuff that we could learn if we would just get our feet back to it. And one of the beautiful things about, I live in one country, and I perform surgery in another country. So I live in the United States, mi casa es tu casa. But I work in Mexico. I have a hospital there. I had a hospital there. I got married, now it's hers. And that's not, don't laugh, it's true. And we do surgery. We're a concentration center for bariatric surgery, weight loss surgery. And we perform around 7 to 10 surgeries a day, every single day. I don't consider our center a health tourism center. I think that's a bad word. I think there's a global standard of excellence in healthcare, and that's what we strive for. And we've done many firsts in our field. We've done stuff like the stuff we were talking about, gastric band, designing the gastric band many years ago. The Obalon balloon, which is a small little pill that you swallow and then it pops inside your stomach, it becomes a balloon and it floats there for 6 months. That's actually here in Carlsbad, Obalon Therapeutics. So we co-designed that balloon. And again, we are in Tijuana, Mexico, and who would have thought, right? You're from Mexico? It's like, you're supposed to be wearing a big hat and stuff. We trademarked the first bariatric weight loss surgeries called a stomach sparing gastric sleeve, a redesign of a surgery that requires no stapling, no dividing, no nothing. It's a pretty cool stuff. But anyways, we didn't come to talk about that. And I've been on some cool shows like Oprah, Good Morning America, stuff like that. But anyways, those guys up there on the right-hand side invited me, called me up and said, dude, are you interested in virtual reality? I said, yes. What is it? And just come over and let's do some virtual reality. So they came over, they brought that little device on the left. Well, it actually, do we have a pointer?
Yes.
What a beautiful. Thank you. All right. There we go. That device over there that we'll see in a little bit. So those gentlemen gave me a call and I said, come on over. So like I said, that's our operating room. We have a state-of-the-art facility, just 5 minutes into Mexico. And one of the interesting things is that, well, I started researching what virtual reality was. And most of you are saying, well, how does that work for us? What are we going to do? Why do we want to do it? So that looks funny. Suddenly, instead of doing normal activities, that's where you're going to do all your exercise, right? And I used to have one of those when I was a toddler, but so obviously in gaming, everybody knows that gaming and virtual reality is one and the same. But who would have thought it would kind of invade other areas? Now in the medical field, we've got addiction and post-traumatic stress syndrome disorders. We're using, I don't want to say we're using because I'm kind of new to this, but science and the medical field are using this as ability coping for skills that trigger relapses and cravings in the virtual environment. Here's another great video, and this is something that really is interesting. You're seeing that gentleman right there wearing a headset, and he's inside the patient's brain looking at a tumor. Now, for most of you, that's going to be pretty cool. But when you're a neurosurgeon who basically is a specialist in doing surgery on gelatin, on jello, well, that's a great advantage because he knows what to expect. So you know exactly the disease before you cut or make a hole in the skull. That's pretty cool stuff. Some other applications that are already there is patient education, either what their disease is or what they're going to go through, what their environment they're going to be at, which diminishes stress on the patient. And you know, stress and disease goes hand in hand. And another interesting thing is tutorials, teaching. Teaching who? Teaching students. I was going to bring 30 of my students, but they drink a lot, and the guy in the bar said, no way. And they want everything for free because they're students. Not only students, you've got physicians, you've got surgeons, you have healthcare professionals that all benefit from not seeing a one-dimension or a two-dimensional learning field. Being immersed, being introduced in a field that's so dynamic, like medicine, like somebody having a heart attack and you've got 10 people, who watches Grey's Anatomy? Only the girls. And my wife. And oh, look at this! It's like, honey, I live this every day, give me a break. So this is a quick video of behind the scenes. And you're seeing a one-dimensional, a two-dimension screen right here. And you've got a screen back there. And then I'm explaining there that, well, I can teach if you see one single screen. but there's a lot of things happening inside an operating room. And the application is interesting. Here's the device we were talking about. Numerous GoPros set in a way where we can create a video that has 360 spherical. You can turn around everywhere and actually see something going on. And for those of you that saw it, and for those of you that didn't, we're going to show a little snippet of it. So before I go to the benefits, let's see if I get some audio here.
Well, welcome to Obesity Control Center, an international center of excellence in Baja. So come on and join me into the surgery. I want to present everybody in the operating room. So we've got our anesthesia team up front, right past this screen. And as you can see on the screen, we're performing a gastric surgery. That would mean a surgery performed in the stomach. This patient suffers from excess weight, and she is undergoing a bariatric procedure for weight loss. To my right, I had Dr. Martinez, also a bariatric surgeon, and we've been working here for around a decade and a half.
This stubborn man.
To my left, you will see him, go ahead and turn around, yes. Remember, you have the ability to turn to my left shoulder and far beyond, and you will see all my surgical tech team. So they have a table which is fully equipped with the latest instruments, and one of them is the equipment we are using right now, which is the harmonic scalpel, a technology which basically vibrates 55,000 plus times per second and separates the molecules with virtually no heat, which is what you're seeing here. So we're going to go ahead and keep on doing the dissection right now. What you can see now on the screen in front of us is the stomach being separated from the fixations or the ligaments around it. And that would be the first step. So in this case, we've got all our instruments, as you can see in the patient's abdomen right here. This is where my hands are going in on top of some instruments that are around 5 millimeters thick. And then they're going through these specialized cannulas which hold the air, in this case CO2, inside the abdominal cavity and do not let it escape. This is how we can actually make a space in the abdominal cavity and lift up the abdominal wall so we can visualize the patient's anatomy. So we're going to go ahead and finish this dissection, and then we're going to go and then proceed to the stapling part of this procedure. We are creating something called a gastric sleeve. And why? Well, because the stomach will result in a sleeve-like looking stomach. This is a procedure that is extremely popular among patients that have either obesity or obesity and diabetes. In fact, some new studies have shown that even patients without obesity that suffer from diabetes can control the disease and revert the symptoms with this simple procedure. This is typically a very quick procedure, no more than 30 minutes, a very low impact procedure. These patients are walking around maybe half an hour to an hour after the surgery. Most of these patients come from the US, that's why you will hear some English and then some Spanish going on in this operating room.
All right, so that is a virtual 360. That was very cool because I didn't have to do anything. I do this every day. So the guys that came in there, they put all their cameras together, and it took them almost 2 weeks to a month to stitch all those cameras together, which means that the technology is barely there. What are the applications? What am I going to use this for? Well, first of all, I don't want to stick 30 patients inside my operating room. Is it time?
Yeah, a real emergency.
My computer. See? I want to stick 30 students inside my operating room. Why? Well, because, well, first of all, they have the privacy issue of the patient, the security issue of the patient, the probability of contamination. They bug me, stuff like that. The inner workings of an operating room might seem a little, well, new to you, but for a surgeon, it's not only about how they move their hands, it's how they interact with their whole team. We've got 10 to 15 people in every surgery, and there's many things going at once. I've got two options. Either teach somebody step by step the 2,000 things that go on at once, or show them the same video 10 times until they learn the procedure in a dynamic mode. That's where the application becomes interesting. The other thing that we're using it now is we suddenly are now using it as a teaching device so students and then doctors can actually respond to a code. A code meaning when a patient's heart stops, suddenly what do you got? You've got a lot of people shouting for stuff and nobody's coordinating. Why? Because the stress level is so incredible. And that's when you lose lives. But if you've got this mental exercise in your brain in a virtual reality environment, when it happens, you're on cue. You're knowing exactly what you have to do. So what do? We put the camera right on the mannequin or the patient. In this case, it's going to be a medical student that's coding. And we've got everybody all around them, and we're recording the scenario to then be practiced live. This technology saves lives. So one of the most interesting things is that as we see this slide right here, it increases visual performance, obviously reduces physical errors, like I was saying. It's low cost compared to travel. In fact, virtual reality is so precise that I am not even here. Right? Those 4 accidents and 5-hour drive. There's no risk in the environment for learning, and obviously not only for the student or for the patient. And before I leave you to the next topic, I will just let you guys know that this is the company we collaborated with, which our next speaker will be talking about. And the applications are not only in medicine, sports, military, and many other new applications that are coming out. So these are the gentlemen that are part of the team, Casey Sapp and Matt John, that were there inside the operating room. And well, we're just trying to advance science. Where is it going? We don't know, but we want to be in that train. Why? Because it's just the start. Somebody was asking me, what do you know about the technology? I know it's new. How many cameras do you know? I know one that's really, really expensive, right? And some other ones that we're trying to, but I'm trying to get a hold of whatever I can, because I want to be able to be one of the first medical libraries that teach physicians, that teach healthcare professionals, surgeons in an immersive environment. So again, thank you for your attention. This is a wonderful topic to talk about.
Thank you, Doctor. That was I would say. The Jared's going to explain some of the technology involved in actually producing that video.
Hi, so I'm Jurgen Sandrew. I am a colleague of the guys that run Virtual, so I've done a lot of this post-production and production stuff myself, but I was not there for this shoot. But essentially, Virtual can provide all of the production and editorial services that you would need to do any sort of medical imaging or education for sports or whatever. So just to introduce myself, I'm Jurgen Schulze. I've been a stereoscopic supervisor for 6 years, and prior to that I was a visual effects artist and compositor for 10 years in Hollywood. I just finished up the finest hours for Disney as a stereoscopic supervisor, and prior to that I was working on The Walk for Sony and Robert Zemeckis. So all of these virtual reality devices are stereoscopic devices, so it's sort of given this whole new industry for people that have worked in visual effects and stereo. All the stuff that we're creating right now with these arrays of cameras that I'm going to show you in a second, they're all considered 360 video. So it's not a game, you're not able to walk around in it, but you're able to experience it as if you're a witness to it in 3D. So here's a couple of examples of some of the camera rigs that you can have. So right now there's a couple two-camera solutions, a bunch of two-camera solutions, which is basically you have two lenses and two sensors on either side, and the lenses cover at least 180 each. So I have a cheap Ricoh Theta, which is a pretty great little tool here. And I can take a 360 video picture or video, but the resolution is really low. There's the GoPros, which have extremely wide, or have wide angle lenses. You can use two of them together and stitch it together, and the Kodak camera. And then if you want to have a little bit better resolution, you can add more and more cameras with longer lenses. If you want to shoot in stereo, so you have everything feels like it's immersive in 3D, you can use these different cameras. The rig that these guys use to shoot the medical experience that you can see out there in the lobby is that bottom left rig. So there's some advantages to shooting in 2D instead of 3D monoscopic. One of them is a higher resolution, and it's easier to do post-production. The Dr. Ortiz mentioned that it took a month to stitch that footage. That was, it can take a month if it's not shot properly from the get-go, but also this was one of the first projects. So it is getting better and better, and also that was 3D. So you have to stitch the left eye image sequence and the right eye image sequence. And there's multiple cameras for each. But when you shoot stereoscopic, and some people that have experienced it out in the lobby, you have a higher sense of presence. You feel like you're there. You feel like you could walk around and touch the people or the instruments. But with stereoscopic, you get a lower resolution because you have to fit it still in the same size image. So just to give you an example of the camera rig, you saw that picture on the left. This is what, it says it's a 14 camera system. So there's 2 facing up and then 10 facing around and then 2 facing down to capture the 360. And the reason they're set up in that hexagon is because each pair of cameras represents your left and your right eye, and the distance is set up very much on purpose because the left one is they're basically set up to emulate the distance between your left and right eye, so that's called the interocular distance. If you look at the camera's field of view, so that's the camera in the middle, this is all representing the left eye. If you look at, let's say, the blue field of view, and then we look at how that is projected onto an unwrapped globe, you can see that this camera that's capturing just the stuff off to the right side is only capturing a very small piece of the experience. And so we have to go back in and stitch that together. So that's what you see here is information that is aligning in left and right eye. because of this, we actually try to stage it in a very specific way so that people aren't crossing over those stitching areas, so that because there's a lot of manual work that goes into that currently. When you're shooting this way, you want to make sure that you have wireless microphones, so there's not cables going around the surgery room. Lighting, we turned off the overhead lights to make sure that there's proper exposure of the surgery. We could have had the overhead lights on, but then you wouldn't be able to see the rest of the room. We didn't shoot down because it just seemed like a waste of work, so we just kind of put a circle in the bottom, which I think you saw in the video before. And let's see. Oh, and also we could do picture-in-picture, so you could add different heads-up display information that you can see floating in midair. So, a 360 video can work on multiple devices, so it can work on Android, iOS, Windows Phone. You can work on your desktop, YouTube. There's lots of different ways to do this. Any modern smartphone. The thing I have out there that you guys can check out is the Gear VR, using just the Samsung Galaxy 6, and the Samsung Galaxy 6 is storing all that information and running it. And then future headsets that are coming out next month and the month after is the Vive and the new Oculus, and the PlayStation VR comes out in October. Once these videos are created, you can watch them on Video or YouTube or Facebook. The gastric bypass surgery is available on Video, which is just an application you can get on your iPhone and look at through Google Cardboard. And that's it. So if you guys wanted to talk to virtual, there's a pamphlet out there. Talk to Casey. Thanks, guys.
Our next presenter is Jurgen Schulze, and Jurgen is an adjunct professor in the computer science department and a research scientist at UC San Diego's Qualcomm Institute. He teaches computer graphics and 3D user interfaces. His research is in scientific visualization, immersive virtual environments, human-computer interaction, real-time volume rendering, and mobile devices for graphics and applications. He holds an MS degree from the University of Massachusetts and a PhD from the University of Stuttgart, Germany. After his graduation, he spent 2 years as a postdoctoral researcher in the computer science department at Brown University before he joined UC San Diego in 2005. Jurgen?
Thank you, Barry. Thanks for having me, everyone here. So I'm very pleased to talk about this topic because this is a topic that's very near and dear to my heart because I've been working with medical imaging pretty much since I started as a graduate student 17 years ago in Stuttgart, in Germany. And I set out to use virtual reality to do medical imaging. That was my goal. And so that works perfectly with the talk today. What I'm going to do though is I'm going to focus on rendering. I'm a computer scientist, I'm not a doctor, so I'm going to focus on how these images show up on the screen. And I'm going to explain to you a little bit how that works so that you get a better understanding of, for instance, how the demo that I'm showing out there, how that works. So basically, this is an image of what we're trying to do in rendering medical data. The medical data that I'm talking about is particularly CAT scans and MRI scans. So these are the kinds of scans where you take a bunch of cross sections of the human body, of some part of the human body. It's often the head, or it's in one of the organs, or when someone breaks something, maybe you take a CAT scan of their foot or of their leg. So that's the kind of imagery that I'm talking about. Now, many of you have probably seen those images, maybe even undergone a procedure like that where you got scanned with a CAT scan or MRI scanner. And what comes out of those procedures is a stack of images. So it's just like your photographs that you take On vacation, you end up with a stack with a bunch of images. Now in this CAT scan or MRI scan, those images are taken from successively different positions, but taken at regular intervals. So it's a cross-section here, cross-section there, like a few millimeters over, and then another cross-section. That can be tens, sometimes hundreds of images that are being acquired. Now these images are normally looked at by radiologists using a regular computer, switching through the images just like you would through your vacation photos. And then the radiologist would look at each image and figure out if the tumor is in there, if there's a fracture, sometimes some part of the fracture seen in it. And the difficulty that they're facing is that the pictures are really of a three-dimensional object. So these could be cross-sections through your head. The head is a three-dimensional object. Now when the cross-sections are taken a certain way, let's say this way, horizontally, then when there's a blood vessel that goes through your head from top to bottom, in each cross-section there's only a little circle of that blood vessel. So if you were interested in an issue, if this was a bone, in an issue that was in this direction, then the cross-sections that way might not show you that. So what you do though is you can take those cross-sections and recombine them into a 3D object. And this is a good example for that. You actually even saw in Dr. Ortiz's presentation, there was a quick video with an Oculus Rift that showed this kind of imaging. And this is a picture that was created on a 3D virtual reality system on Z-Space by a company, it's called EchoPixel. They probably make one of the best volume rendering systems these days that they use for educational purposes. And here you can see this was heavily manually processed, this model, but you can see bone, you can also see some soft tissue and some arteries and blood vessels and so on in this image. And you can already sense that that's a 3D data set. That makes a lot of sense to look in 3D, look at it in 3D and rotate around and look behind things that block the view of other things. Another use, so that's looking at these image sets. Another use of this technology is to use the image set as a sort of a foundation and then simulate what you're about to do. So in this case, for instance, there is an aneurysm in a blood vessel. And here you can visualize the blood vessel, but you can also actually simulate the blood flow and figure out where the issues might lie and where you might want to place a stent, for instance. So you can use that information from those images in order to run simulations and then simulate treatment before you even implant that treatment into the body. So this technology is used in those cases. And this is a picture that sort of shows what's going to be possible in the future, which is that we're going to be able to use the data that we acquire with CAT and MRI scanners and then present it to the doctor while they do surgery, much like the surgery that you just saw in Dr. Ortiz's video, where the doctors do the laparoscopic surgery thing, and they look at a video that they shoot live from inside of the body that's taken with a camera, sometimes even 3D cameras, stereo cameras, but they only really see that little part that the camera's at. But it takes a lot of practice, as far as I can tell and know, to know where you have to go with that laparoscopic instrument so that you don't cut the wrong ligament and the wrong tissue in order to get to where you want to get. So what you can do in theory, and in the future that's going to be possible, is you can use augmented reality technology. And here you can see, and I do this with my hand now, there's this guy wearing an augmented reality headset looking at a patient, and what the person will be able to see is that imagery that I showed you. Oh, there's a laser pointer. Anyway, I think. Let me try something. Okay, great. So there's the headgear, and this let's say this is a surgeon is looking at the patient, and what would be possible is to display the 3D model of what it looks like inside of this patient for the doctor, so that it looks like it's right where it is in the patient. So they have a much easier way to orient themselves around the inside of that patient. So now how does this work? In order to do this, we use a technique that's called volume rendering. And this volume rendering is a sort of an overarching term that describes the technology, the different technologies that are used in order to take the 2D images that we acquire with MRI scanners and CAT scanners and turn them into a 3D model that we can then look at in virtual reality or with other 3D displays. And there actually is a wide spectrum of application domains, not only medical applications, but we can use this for biological images, for instance, cross sections that are taken with a microscope, and also in a variety of other disciplines where we take cross sections of things and have 3D interior data, such as sonar scans of the ground. What we have to do now is, when you look at these images, imagine you have a stack of images. How do you even turn that into a model that you don't just look at the outside of? You can imagine stacking up these pictures as if they're printed photographs that would turn into a block, into a rectangular block of paper that you look at from the outside. That doesn't show you what's inside. So the trick is to make parts of these images transparent. And that is really what this technology is all about, is making the right things transparent so that you can see the things that you want to actually see, and that you can look into the 3D model as if you're carving out the things that you don't want to have in the model. And that's done by using transfer functions. And a transfer function is a term that describes a transfer of from the data domain. So this, for instance, here is an image that could be one of these cross sections that you might be looking at. In this case, it's a tooth. So this is a cross section of a tooth. And this is a 2D image. It's one cut through the tooth. And what we have in this example here is a whole stack of these cuts. And together, the cuts make up the tooth. But when you just stack them up, then it's just a black block of data. And transferring now from these pixel colors into colors and opacities is the trick that we're using with these transfer functions. So we have to design a mapping of going that allows us to go from these grayscale values to both colors, so that we can color this if we want to. Oftentimes doctors don't even need the color, they just stay in the grayscale domain. But we definitely need the mapping to opacity. And opacity means transparency, so the more opaque something is, the less transparent it is and the more you can see it. So in order to get a tooth like this, we have to make everything that's air around the tooth, for instance, transparent. And then depending on what we want to see, if you want to see the root maybe shining through the enamel here, then we would have to make the blue stuff translucent, which means not entirely opaque, but also not entirely transparent, so that you can see it, and then we can see the root. And that is done with these functions, and they allow us a great deal of flexibility in order to turn these image sets into 3D models. Examples for different opacity transfer functions are, for instance, these 6 here. That's all using the same data set. So this would be a data set that was scanned, a CAT scan that was done of a patient's abdomen. And then this is all the same data set, but using different transfer functions, different mappings of opacity. So you can either pull out the surface, the skin, or you can pull out what's under the skin, the muscle tissue. You can pull out the colon here, for instance, or the bone. And that's all possible using the same image set. And that's actually the parameter that some of you have already played with in my demo outside. There's a parameter that allows you to do exactly that. And in order to do a better job pulling out structures off the data set, we can do what's called filtering, which means that we can find edges of structures. So if you want to see an organ, for instance, you want to find the edge of the organ where it turns into, where the pixels in the images turn into the surrounding tissue. That's done with filtering. And then we can use all that information to create a more complex transfer function, which I'm not able to entirely explain today. But for those of you who do understand a little bit, this is the image data here, and then there's the sort of the edge information about how much of an edge is the pixel that we're looking at. And that way we can design a very complex transfer function that allows us to pull out these edges in these images in order to make the three-dimensional rendering look more like what we want it to be. So here, for instance, we have these different transfer functions. This one would pull out the same data set. So these are all shot with done with the same CAT scan. We can show the root, or we can show the tooth as a whole, and that's all doable with these 2D transfer functions. And then there are different ways of looking at these image stacks. So one way that I explained is that you would look at the whole stack and use these complex transfer functions. But you can also just look at the cross sections, or you can do isosurfacing. Isosurfacing means you would calculate a surface out of the data where you have a brain scan that you would calculate only the brain of the surface of the brain matter. And that would give you a model that looks like someone cut that brain out of the head and put it right in front of you. That would be isosurfacing. That looks generates very crisp images, but you don't have any of these translucencies in there anymore. And then there's that direct volume rendering that tries to apply the translucencies in order to look through parts of the data. And it all depends on what you're looking for. What you're looking for determines what imaging methodology you're going to be using. So the simplest one really is maximum intensity projection. This is what X-ray devices do. When you have if you have your head X-rayed, a traditional X-ray would take one shot through your entire head and map it onto a plane, and that's what you see. And when there's more bone along the light path, then you will see more white. And when there's less bone and less tissue overall, if the light goes through softer tissue, then you'll see a darker pixel in the image. And that's done with your teeth when you go to the dentist, or when you have your hand. Let's say you broke your hand, you'll have an X-ray done. That's often just X-rays, things that are more flat. They just do, or when it's not supposed to cost as much, you use X-rays. And this is the same effect that you could apply onto a CAT scan. You could turn it into an X-ray, and that's called maximum intensity projection. And then this isosurfacing produces a nice surface. So in this case, there's the surface of the bone was picked as what we want to see as a surface, but you could just as soon pick the surface of the brain, and then you would see the brain. But you can't see anything else. So in this, you wouldn't see the brain, and you can't see the tissue around the skull. So you only see the bone. And then you can do transparent isosurfaces that you could even nest. And you could have multiple of these guys nested inside of one another to see through it a little bit. And then there are these ray casting and isosurfacing. So this is ray casting, which means what we were talking about with the translucent rendering, and this is a combination of translucent rendering and isosurfacing. So I'm just trying to show you what range of imaging modalities that there are even on the rendering end. So this doesn't include any of the parameters that the doctor has when they do the actual CAT scan or MRI scan. And then what they do in all of these methods, you would take the original images, the image stack, stack them up into a cube, and then out comes that 3D image. And that's calculated in real time. That's what we have to do for the demo outside. These virtual reality devices, such as the Oculus Rift that I'm running the demo on, they require an immensely high image update rate. The Oculus Rift, for instance, the one that I'm using out there, the DK2, uses 75 updates per second, and that's for stereo. So really, for each eye, we have to render a separate image that makes it 150 updates a second. Whereas you normally with your computer, you probably only have 30 updates a second. So we already need 5 times the rendering power to do this volume rendering with the Oculus Rift. And the new Oculus Rift that's coming out in the Vive, the HTC Vive, they're all using 90 frames per second updates, and that's 180 for stereo. So that's a lot faster than what we normally render, and that's why we need these high performance computers to do this. And what they do is they simulate light rays that go through that 3D model, that 3D data set. And for every pixel on the screen, they calculate how the light path would look through that data model. And that takes a lot of computational power. And that's why in volume rendering, I said that I started this 17 years ago. And at the time, we used $1 million silicon graphics mainframes, which allowed us to do this just barely. But now, with the latest graphics cards that are just in the hundreds of dollars, we can do this amazingly fast. That will be probably over 100 times as fast as back in the day. So this again shows how we composite the images. Example for maximum intensity projection. We use 3D texturing. So these are all tricks that game programmers actually implement in order to make games faster, but we're using them to do medical imaging faster. We stack up these images, and then out comes a 3D model. And now that 3D model we can of course also take and print, and we in fact designed a tool that allows us to turn these 3D models that we can look at in virtual reality, we can turn those into a printout, into a 3D printout using 3D printers, and that's a workflow that we now have established so that we can go ahead and turn essentially any 3D model that we have into a printout if we just know what we want to print. And this is what it looks like. So out there in the corridor, you're going to be able to play around with it and play around with different CAT scans and MRI scans that I've brought with me. You can change the visualization parameters. You can assign false colors and play around with make the display bigger and smaller. Zoom in, stick your head inside of the brain scan. And this is, I'm very excited about this because it was never possible to do this at this high quality in virtual reality before. This is the time that this kind of volume rendering really works very well in 3D. And for all of those of you who are doctors who've tried this maybe a few years ago and it was kind of choppy on the screen, or you had the option of either having choppy images that were high quality, or you have the option of doing fast rendering at low quality. Now we can actually do both. We get high quality, non-choppy images, and it's awesome. So I will encourage those of you who work with CAT scanners and MRI scanners to try this stuff out. The software that I have is actually freely available. I have it on my website. You can contact me to get it. You can come to my lab at UCSD if you want to. Bring a data set with you and a stack of DICOM images and alternative for you into one of these 3D models. I think that has a lot of future. Now, where does this all go? I think medical imaging with the virtual reality is going to allow us to get better insight into data that we can currently acquire. It can help train people, medical personnel, in never before seen ways. That video that we saw earlier is one way to train medical personnel. Simulating surgeries is another way to train medical personnel. Simulation of surgeries has been done for a long time, but now with virtual reality you can do it in a way that it really seems to be like you're really operating on the patient in front of you rather than looking at a screen with which you do a simulation. So I think there's a qualitative shift going on in this realm of using virtual reality for medical training, medical practice, which is starting this year with the availability of inexpensive consumer virtual reality devices, which is never before seen, and this is the time to get into that. So I think that's what I will leave it at, and I'm happy to take questions in the Q&A, and thanks for your attention.
Thank you, Jurgen. We've got about 10 minutes for a Q&A. Any more questions? Yeah. You guys want to do? Jared, you here? No one has any questions, then we'll just look at them for 2 months.
Jared, can you talk a little bit about the challenge of stitching?
Yeah.
Did you hear?
I can. Yeah, so...
Do you want me to repeat the question?
No, I heard that. So the question was, can I talk a little bit about the challenge of stitching? So, yeah, essentially you have 2 or more cameras that you're working with, and the wider the angle of the lens, the more parallax you have. So if you're looking in one direction with one lens and you're capturing in the other direction with the other lens, where the stitch is, there's going to be a parallax issue. And so when you unwrap it, which I can show you guys some examples of that out there, it doesn't line up exactly. And so you have to go in there and manually warp it and adjust and paint it together in an application similar to like what you would imagine is Photoshop.
Has that been automated?
There are ways to automate it, but there's at different depths you're going to get a different amount of parallax. So you could align for the background, and then the foreground elements aren't going to align as well. Or you could align for the midground. I think that there's probably everyone's working on this right now, so there probably will be some more automated ways to do that. But I think that there's always going to be a little bit of manual intervention.
Are you familiar with Nokia Technologies Ozo?
Yeah, I've seen that.
Can you care to comment on that?
I don't know, do you work there? No. It's very cool. The thing that I've noticed when I've seen demos of it is that you're switching from two cameras that are facing this way, and one represents your left eye, and one represents your right eye. And when you turn your head just 20 degrees in the 20 degrees towards the left, your eye switches. So the camera that you were using for your left eye is now your right eye, and there's a new camera that represents your left eye. So there's this dissolve that takes place that bothers me. But I'm also crazy, and I watch this stuff all the time. So
Is it possible to solve? Is it possible to solve the stitching issue? Is it possible to solve the stitching issue if the lenses were nodal, using rectilinear lenses and thermally stable housings?
everybody's working on their own way to do that. So, I mean, it just depends on how close can you get the zero parallax point of the lens to the center. I mean, all of these cameras that they're coming up with are trying to make them nodal, but you can't get that zero parallax point to zero. So a lot of the stuff that I've done that's completely CG, it's a piece of cake because you can put a virtual camera in the center, and that virtual camera is its zero parallax point in the same place for all cameras or one shader.
If the cameras are static, can you come up with just one stitch that works for every shot?
Yeah.
That's
As long as things that are in the background don't come to the foreground, because then their stitch is going to change a little bit. So, I have some other examples if you want to see after. I can show you some stuff.
Thank
I got a question.
Why? I guess because my demo wasn't as good as yours.
So stereoscopic really makes a difference. I mean, we saw that when you see monoscopic. Anyways, I didn't even know what we were talking about. 360 stereo. But anyways, is there anything commercially available yet that kind of simulates what you guys make?
I mean, the GoPro rig that we used is commercially available. And then all of those cameras that I didn't quite go through and explain, they're all commercially available. It's just that the post-production process is in flux. Everybody's trying to figure out what that is. There are a couple of companies like Jaunt VR that has a workflow that they say is automatic. And Lytro is coming out with a light field workflow, but these cameras are so expensive. It's going to take a long time before it gets into any of our hands. I think John only has a few of them anyway.
Yeah, John does real time too.
It's real time.
Yeah.
And then there's
Live.
there's Video Stitch, who's at Jurgen's VR Summit. Theirs is semi-automatic, but it's still not perfect. You still have to have some manual intervention.
Could you describe a little how you stitch that together? How to sort of visualize that.
So
on a photo you can see it.
yeah, so
moving 3D.
you have multiple cameras and they're all facing out and they're all capturing what is in their field of view. And so you basically project all of those onto a virtual sphere. So you're on the inside of a globe, and you're projecting them out, and then you align them based on visually what looks natural, and then you manually stitch it together. I have a stitch reel that I can show you guys of how that works. I should have shown that. That would have been
Right.
He does it with like 145 megapixel images. Like what?
We do this for still images, and for still images, it's hard enough to do that right. It does take a lot of manual work to do it completely right. But the real trick is for video to do it right then, because it's 30 frames per second or more.
Yeah.
And sometimes it takes us a whole day to just do one frame right. That's granted, this is over 100 megapixels, so we have extremely high resolution. We're actually also working on one of these 3D cameras. We got a grant to do this, and one of the issues is time synchronization of the cameras, frame synchronization. And this is, maybe I should ask you that because I'm really curious about using that GoPro rig where the cameras probably are not synchronized. How do you deal with that when you stitch the images together?
So GoPro has a utility called Auto Pano Video, or what is it called? It's called Auto Pano Video Pro or something like that. And it uses sound and or motion vectors to sort of figure it out. So when Casey went to North Korea and shot his piece in 3D, he just went up to the rig and snapped his fingers a few times, and then we were able to use that to sync up the cameras. So Color, the GoPro application, will do it semi-automatically, but you could also just align it yourself that way. I thought that GoPro, I haven't been shot with GoPros much lately, but I thought that they made it so that they were able to be gen locked. Am I wrong?
Well, that's not available to the normal people. Maybe Google.
I think we have some GoPro engineers in here.
Yeah.
Raise your hand.
All right, tell us. Come up here.
Alright, I don't work on the VR stuff though.
Oh, okay.
Quadcopter and then camera stuff, so sorry. So that's why I'm right here, I'm listening and spectating.
Okay. The next.
Dr. Ortiz, I wonder if you could tell us whether you think at some point in the near future it's going to be impossible for a surgeon to operate without aid for both his eyes and hands. And I really would like to know when you think that's going to happen, because I bet it will.
That's a spectacular question. There's an author of a book, and he was the professor of surgery considered worldwide. And when I was back in school in the day, I studied his textbook, and when laparoscopy came out, basically the use of instrumentation, small little scope with a camera mounted on one end and introduced into the abdomen or into any other natural cavity. And using these specialized instruments, small little holes instead of traditional open surgery, he criticized it and said it was going to go nowhere and it was a joke. That was late 80s. Like 5 years later, he actually wrote the introduction, the prologue of a book that specialized in laparoscopic surgery. So 10 years later, you see that technology is used dramatically to enhance the surgeon's ability. And now it's advanced to a point where there were surgeries we couldn't do. And I'll give you a great example. These guys are going to love this. There's something called a robot, which is a slave robot. A slave robot basically does whatever, replicates whatever you do. But surgery in the heart, let's say in a beating heart, was never, could not happen. Well, because nobody can do surgery on a moving object, much less when it's small millimeter movements. So what the robot does is that it connects to the heartbeat and the instruments beat with it, and the user is connected to a cord like this in a separate room with the user being a surgeon, and he's got a screen, but the heart's not moving. Why? Because it's filtered. So the camera's moving with the, so they're doing surgery, they're doing surgeries that couldn't possibly be done. Now, when you see these advances in surgery, you can't go back. It's kind of like Viagra. I don't know if they came out well, but there used to be hydraulics and all these surgeries. That doesn't exist anymore. Why? You take a blue pill. That's it. That's done. It would seem like, oh my God, it's like barbaric to go back and doing these aggressive surgeries when you've got that pill. I think it's coming, and it's coming soon. And that's why there were 4 accidents and hours and hours of traffic, but that's why I came. Because I know this is the future, and it's very close. But great question.
Jurgen, I really enjoyed your presentation and your demo outside. Most of the 3D reconstructions that you performed are with relatively high resolution images like CT scan and MRI. Can you use other types of medical imaging, for example, ultrasound, and can you layer that onto much higher resolution imaging from MR and CT?
That's a very good point. So first of all, ultrasound, yes, you can completely treat that just like it's the imagery that you get from CAT scans and MRI scans. The fun thing about ultrasound is that 3D ultrasound is possible where you capture an entire 3D volume pretty much all at one time, because there is a 2D scanner that scans very quickly over the volume, and then you can capture a video of something like a beating heart, for instance, and capture that in ultrasound, and then play that whole video instead of a 3D volumetric video, which is very cool to even just watch. It's amazing actually, because you can slice through and see how the heart, I have one of those videos, you can slice through and see how the heart beats and how those ventricles open up and whatnot. Now, can you mix that with other modalities such as CAT scans or MRI scans? So that is a sort of an image matching problem. A frequent problem is that when you have a patient and you do a scan of a body part that's flexible, so maybe your insides in your abdomen are, and you have a CAT scan done, then the patient gets up and they walk over to the ultrasound, they lay down again, but they don't lay down exactly the same way they did the first time when they did the CAT scan. Then the organs are slightly differently arranged in that scan, and then you have to match it and morph it into one that matches the first scan. And then you end up with morphing that's very similar to what Jared does for the 3D videos, where you match one image to another, one 3D image in this case to another 3D image, in order to be able to have, let's say, the organ be exactly in the same place in the CAT scan and also in the ultrasound. But it is possible to do it. It does require some manual work today. There's no good automatic way to do this yet. And it's very, very similar work to what the image stitching in video, in panoramic video is all about.
Thank you. Well, thank you. I'm on a schedule now, so if there are any other, we could probably take one more question. Well, okay, I want to thank our panelists, and they're going to be around afterwards, so you can always go and take a look at the demos afterward and talk to them some more. Thanks, guys. Okay, and now for the entertainment section. Would you turn the flights down? All right, we're going to talk about augmented reality and virtual reality and in storytelling. Basically, storytelling including performing arts in the entertainment industry and where it's going. And I think that I like to think of this as more of a talk for potential investors, where things are going, than it is anything else. I think investors get the most out of it because I love this serenading in the back. I've spent almost 3 decades in the entertainment industry. I have a doctorate in neuroscience. I was on staff at Harvard and Mass General, but I left that to come to Hollywood and invent the process of colorizing black and white movies. Did that in the late 80s, early 90s. A lot of people say what I was doing was destroying our American film heritage, but I let that roll off with that. No, I really wasn't. There's a whole bunch of information about that whole controversy that would be an entirely different seminar. This is something really. I want to talk about a progression from colorization to 3D all the way up to virtual reality and augmented reality, and the lessons that can be learned from that. When I first came to Hollywood, I didn't really know anything about movies. I didn't even like movies, to be honest with you. And when I went to Hollywood, everything was filmed. Everything was analog. And the idea of anything going digital, movies going digital, was so impossible, it was discounted out of hand. There was a whole machine that was built around film, distribution, color timing, developing, all of that was built into the film industry, along with the unions and legacy contracts with the studios. So when I came to San Diego to develop the process, basically I had to figure out a way of actually digitizing an entire feature film. That had never been done before. And if I had asked anybody about it, they would have said it was impossible. And fortunately, I didn't ask anybody. But so in '87, I digitized Bells of St. Mary's with Bing Crosby, and that was the very first entire movie that was ever digitized. Technicolor, it took Technicolor another 3 years to duplicate that. And damn it, I didn't patent it because I didn't even know it was special at the time. But what I want to try to do is give you a unique perspective on virtual reality and augmented reality. And again, this is my perspective. I colorized about 250, 300 feature films over the course of several years. We did, I mean, some of the top movies that were ever produced. And it was very successful. The problem is that it was successful, but not everyone liked it. And it had nothing to do with the moral issue, the creative issues. It really didn't have anything to do with that. It had to do with, some of the audience, they felt the color got in the way. It took away from the raw emotional impact of the story. Now remember, the movies that I was colorizing were not the movies we see today. The movies that I was colorizing were character-driven movies. There was no special effects. So they were considerably different. It didn't matter that this was a black and white flip book. I mean, what I mean by a flip book is, little flip books with animation. Well, when you're watching a movie at 24 frames per second, it's just above our flicker fusion threshold, right? Which means that, I'm talking about the flicker fusion, so you don't see the frames going through, but it's different than something like what Peter Jackson was doing, trying to get 120 frames per second for The Hobbit. And nobody liked that. Nobody liked that. Why didn't they like it? For the same reason people like 24 frames per second. They felt it was something other than real. It took them someplace else. It was above a book, but it was not quite different, if you know what I mean. It took them into the story, but it didn't actually, it was not real. They knew it was not real. And so some audiences just like to be passively told a story. And that's one of the reasons why there were people who preferred to see these movies in black and white. Digital television came about only last decade. And I reinvented colorization. But I did it in high definition before it was standard definition. And the technology allowed me to really improve on the process. So I did movies like Holiday Inn in 2007. And the color is photoreal. You can't really tell that it was colorized. I also did It's a Wonderful Life. I think It's a Wonderful Life was done about 4 or 5 times. This was the definitive one. This is the most successful DVD Blu-ray that Universal or Paramount ever produced. It's a Wonderful Life. In fact, all of the children that were the Bailey children who were still alive made a pilgrimage to our studio to thank me for actually putting it in color, because it was finally so good. They actually, every Christmas they go around and give seminars, and they only use the colorized version, which is very nice. And, we even did television shows like this, and we were able to track plaid. All right, wait. So, and this particular thing was black and white. And Desi Arnaz wanted to be in color, but he couldn't put it in color because of budgetary concerns. So we colorized it afterward. And he took a lot of home movies of the set and all of the costumes and everything. So I had a perfect color reference. So everything in here is perfectly accurate. So let's fast forward now to 2007, the emergence of 3D digital cinema. 2007, a good friend of mine, Greg Passmore, who is an engineer, is a genius, and I've been working with him for many, many years in colorization software. He coded all of my inventions. He showed me a 3D ready, Mitsubishi 3D ready television. And it's the first time I had ever seen a digital 3D television. And it blew me away. I mean, I thought I found religion. I really thought that this was going to be the future of entertainment. And he had a problem because he builds his own 3D rigs. He's a stereographer. So and these rigs are as big as a couch. And he's also a spelunker, so he goes down these deep caves all over the world, 1,000-foot caves. And he brings these cameras down there, and he simply can't do it. So he wanted to find a way to actually produce something in 2D and then convert it afterward to 3D. That way you can go in the water, you can do scuba diving down in the caves, and you can get a good red camera or whatever down in those caves and shoot, without having to worry about stereo. And we knew that there were some movies that were converted. Nightmare Before Christmas was a converted movie that was originally done in 2D with stop motion. And there was another company called N3 that had a process for converting movies from 2D to 3D, but it wasn't a very efficient method, and also the quality wasn't there. So I diverted all of my R&D from visual effects and color to 3D conversion, all of it. And I did it in 2007 because I knew that Jim Cameron was going to be coming out with Avatar. And everybody in Hollywood knew that Avatar was going to be a game changer. It was going to change everything. And it was going to change the way we think about movies. So I wanted to be ready for that because I figured all the studios would be jumping at it. So you look at these are all the movies that were done, released up until 2008. And then 2009, Avatar came out. And it certainly was a game changer. Now, forget about the story, how bad that was, but the 3D was absolutely magnificent for the time. And what happened was, as predicted, the studios were all saying, well, forget about everything you thought about movie making. 3D is now the future of storytelling. And there were a number of movies that were slated. One of them was Alice in Wonderland. And right after Avatar, a month later, I got awarded Alice in Wonderland from Disney and worked on it with ImageWorks from Sony. Did about 25 minutes of it. It was very successful. And then afterward, we got a call from Jeffrey Katzenberg, who wanted to do Shrek 1, 2, and 3. Now Shrek, of course, is an animated feature, and it's in CG. So basically, if you wanted to create a 3D movie that's animated and it's in CG, all you need to do is create a second virtual camera. So everything is 3D in there. So usually you only see one camera. Just create another camera and you've got stereo. You got a left and a right eye. But Shrek 1, 2, and 3, they got rid of all of the data. There was no data anymore. So the backgrounds are gone and all of that. So we had to basically start from scratch. And Shrek 4 was shot in 3D. It was actually created in 3D by the artist. And what Samsung wanted to do was to bundle it all in their new 3D television. So they wanted all 4 of them. So we did it, and it took about 6 months to do it. Jared was instrumental in getting that thing done. After that, we got a call from Paramount Studios. They wanted me to do Transformers Dark of the Moon with Michael Bay. And that was going to be a really big one. Very, very heavy visual effects. And it went on and on after that. And what happened is all of the directors started to fall in line and feel that 3D is actually going to be a game changer. Of course, Jim Cameron thought that every movie is ever going to be in 3D. But you get somebody like Ridley Scott says he'll never work without 3D again. Martin Scorsese, who did Hugo, he just absolutely loved it. He didn't know what he was doing. He'd be the first person to admit he didn't know what he was doing when he did Hugo. But it came out beautiful, really came out beautiful. And Peter Jackson, again, shooting The Hobbit in 3D was great. If he had done that and left it at 24 frames or 30 frames, whatever, just not 120 for instance, might have been more successful. But everybody started to think 3D is here to stay. And if you look at the screens, I mean, look at the dates here. 2006, the red is the digital screens. So there was a tremendous rush to get these digital screens installed, especially because of pressure from studios and Jim Cameron. And then the 3D installations came afterward. And again, look at this. 2007, when I took a big risk and changed the entire direction of my company, this is global. I mean, there were a couple hundred theaters that could show 3D in the world, and there were no televisions. Oh, you can go to Best Buy and you can see a 3D ready Samsung or Mitsubishi, and then you ask the guy there, the salesman, what is that 3D thing in the back? And they say, I don't know, I have no clue. Because they weren't selling 3D at the time. And Texas Instruments just put the chip in there for no reason, basically free. And so they were 3D televisions, but there were none being sold for that purpose, and there was no content really anyway. So over the course of the past 6 years, my company, Legend, has done some of the highest performing box office feature films of the past 6 years. Life of Pi, Little Mermaid, we actually converted the classic, Green Hornet, Green Lantern, of course Alice in Wonderland, Maleficent. We did a lot of movies, and Jared just finished The Walk, which I think is probably one of the best 3D converted movies that's ever been done. And I place it even above Gravity. I don't know if anybody saw Gravity, but I placed it above Gravity. And then he finished for Disney, it came out last month, Finest Hours. Not too many people saw it, but it's a very good movie. Let me give you a real quick example of how this is done using The Walk. So basically, if you look on the right, everything is segmented. Over the left, this is the shot. Everybody knows the movie. It's basically about the guy who walked a tightrope across the Twin Trade Towers when they were first built. They got arrested for it. Very famous, and we did a documentary on it. This is a dramatization of that very, very good movie. So anyway, here he is, and he's just coming over to where the cops are. He went back and forth 12 times. But in this particular shot, so everything is dimensionalized, and what I would normally do for color, by the way, the pipeline for 3D, 65% of the pipeline for converting a movie from 2D to 3D is my colorization process. So I didn't have to go too far to actually get this thing done. I just had to invent the last part, the conversion part. So normally what I would have done is put a color into this, basically a color transfer function, a lookup table. So there'd be many, many of those. But instead of doing that, what we're doing is we're using those to actually dimensionalize the scene. Now you'll see the user interface. This is similar to our computer user interface. And what we do is we use those segments and we extrude them out, like that. All right? And there's a lot of fine volumetric segmentation that you didn't see in the original one. But what's happening is every one of these things was placed there by an artist. This is not automated at all. So it's a creative process. And this square right there, that's the screenplay. That's the actual movie screen that's simulated within our software. So anything that's outside of that, that's in the audience. It's over the audience. Everything inside is deep. Now what we do then is we create two virtual eyes. So we take one image and we create two brand new images, a left and a right eye. And basically it's real simple. You put your finger up in front of your eyes and you go one eye and then the other jumps. Well, it jumps because of the disparity, the difference between your two eyes. There's a certain amount of disparity that turns into stereopsis or 3D within your brain. The further away from your eyes, the less something jumps, and eventually it stops jumping entirely, which means there's no 3D at all. It's no stereo at all. People use monocular cues for that. But the creation of disparity is absolutely critical for 3D movies, obviously, and it has a tremendous impact on how a movie is perceived. Let me show you how we use it creatively. Well, first of all, if you look at, if you're at a movie and you see somebody put a hand out, you know, right in the screen, something that's close, a real close-up of somebody's hand, and it's in 2D, well, there's no disparity. So your brain is saying, okay, it's over there. It's not here, it's over there. But if you have disparity, in other words, if you actually create that disparity, your brain is saying, okay, no, that thing is right here. And it really feels like it's right there. So it has a tremendous impact, and it also activates parts of the brain that are not normally activated in a 2D movie. Let me give you an example of how we use it creatively. Anybody see Poltergeist? Okay, two. Okay. Yeah, it's a scary movie. But this movie was shot in a very strange way. It was shot with a lot of angles, and everything was kind of distorted. But we wanted to really add to the scariness of it. And so here's an opening shot, and this Weeping Willow is a significant character in the movie. It attacks a little boy, so we took that and we brought it out into the audience. So it's right in with everybody. It's right there in your front row. I mean, the row in front of you, rather. And what we did is we pushed the rest of the scene back inside the screen so that the family feels vulnerable. In this particular shot, the poltergeists are active, and the father and the mother are upset about it. We added volume, but we also elongated them, and we changed the distance between their eyes and their ears, like would happen with the dog if they're scared. And all of this is subliminal. You wouldn't see it if you looked at it. I mean, if you stopped on a frame, you might say, okay. But for the most part, everything I'm showing you is subliminal, but it does have a tremendous effect. This is a scary doll, major part of it, very incredibly scary doll. And what we did is we converged. We put this screen behind the movie screen behind this doll. We added volume so that the doll was in the audience's lap. In this particular shot, this doll actually rolls towards the closet. The closet is where the poltergeist lives. So, and this was a very clever shot because it's going towards the closet and it's enticing the little girl to actually follow it. So what we did was we elongated the whole room, but we also took the floor and we brought it down, we angled it, so that the doll's not only rolling towards the closet, it's also rolling against gravity, so it makes it eerier. In this particular shot, there was nothing very subliminal about this. We just wanted to make the other side, which is inside the closet, as deep as possible. We made it go forever. This is a great shot. We placed conversion, in other words, the screen right here, right where their hands are meeting. We elongated her. This is real deep. We elongated her, but with the convergence here, the mom is with us in the audience. We're the safe zone, so we're trying to bring her in. You're not going to get that in a 2D movie. So, but not all 3D conversion is done subliminally. There are a lot of technology and a lot of cult movies that use it in a more dramatic way. Now, I'm going to show you something. If anybody gets squeamish, if anybody gets upset by bad stuff, look away for about 2 minutes. This is a movie called Final Destination. What happens is they were at the races, a Formula One race, And one of the cars got in an accident, and all, you know, basically all cars got in accidents and went into the bleachers, and people got killed. Everybody ran outside, and then what happened was.
Yeah!
Okay, so what just happened there? What happened? Now remember, the closer it comes to your eyes, the wider the disparity. Now, in 2D, yeah, that was pretty nasty. In 3D, though, if you were sitting in a theater, these two characters would be in the row in front of you. Okay, so when the tire reached the asymptote, it started to fall, but it wasn't falling directly towards you. It started here and then started going towards us. And disparity is the most accurate measure of distance, direction, and velocity. It provides us with that information, and it does it in a very interesting way. I mean, there are several parts to the visual system, and one of the parts is called the magnocellular pathway. And it's heavily myelinated, which means it's very fast, and it's very primitive. It goes to the tectum, it goes to the superior colliculus, which affects eye movement, and it has disparity-sensitive neurons throughout this entire pathway. And it is very few synapses away from the limbic system or the amygdala. Whoops. Okay. The amygdala. And the amygdala right here is responsible for fight or flight. Now, we've all had the experience where we got out of the way real quick and we didn't even know what it was. Well, the magnocellular pathway is low spatial frequency, so there's not much detail. It's monocolor. There's no color in it. It's high contrast. So you really don't know what it is. And we call it the where is it pathway. The parvocellular is much slower, but that's high spatial frequency. You can see the detail in it. It's got color, and it's low contrast. So that's not as important to us for survival. That happens afterward. But if in a 3D movie, because of the disparity, you can very easily activate a magnocellular part of the pathway, a very primitive part of the pathway, and create significant autonomic responses you wouldn't normally get in a 2D movie. So, well, 3D has been successful. Not everyone's a fan of 3D. Going back to 2D, going back to colorization a little bit. Some people don't like wearing 3D glasses. Some people get sick of 3D movies. If you do get sick of 3D movies, go to the last row. Your eyes don't have to work as hard. Some people don't want to pay the upcharge. And some people don't like the intrusion into their personal space. It's amazing that some people, I ask people, did you see Gravity? Yeah. Did you see it in 3D? No. And to me, you've only seen 20% of that movie if you've seen it in 2D. And like colorization, people want to be told the stories. And that's what I came to realize with 3D, and those people who really don't care to go to it. I personally won't watch a movie unless it's 3D. That's how much in a bubble I am. We all do that. A bunch of techies get into a bubble. And to me, the only thing that exists is 3D. You know, but obviously for the majority of people, I mean not the majority, of people, 2D is fine. And 3D is great for a very significant portion of the audience, but it's not for everybody. Today, there's less movies being produced in 3D, although in China it's very, very big. You know, in terms of 3D televisions, it's very difficult to get a 3D television right now unless you get a premium 4K television, and it's not being sold as a feature. And, you know, one of the problems is 2010, right after Avatar came out, all of the studios were excited about this, and the consumer electronics industry was very excited about it, too excited about it. I just want to point this out, that in spite of the fact that 3D is not for everybody, the top the top movies, the top performing movies today of all time and of 2016 were 3D for the most part, and they were all converted. But in terms of the consumer electronics industry, smart money from Silicon Valley and Hollywood, you've all seen this, right? This is the little hype graph. And basically, it follows this technology trigger, plateau of immature technology, peak of inflated expectations, a trough of disillusionment, slope of enlightenment, and plateau of productivity. Most new technology follows that graph. And I think that right now, 3D is probably around here, probably the plateau of productivity. But in 2010, when 3D first came out, what happened is the lemmings metaphor was perfect. I mean, that's what happens in Hollywood. Nobody does anything. They're always trying to cover their behinds, and they never want to take any risk. But once someone does, everybody goes. And the same thing with the consumer electronics industry. One company comes out with a 3D television, they all come up with 3D televisions, right? I mean, and that was me, by the way. I was there as a lemming, but I'm still there. I still believe in 3D. I think 3D is fantastic, and I know it's not going to go away. Fast forward to 2015, and we've got the spectrum of virtual and augmented reality. We go from the real environment through augmented reality, forget about that, and we get into virtual reality. And the difference, of course, is with augmented reality, we are in our normal reality, but graphics are introduced to it. Graphics in terms of heads-up displays and all of that, and CG elements like animals or whatever. You probably saw some stuff out there that's really from Octagon Studios. It's really amazing. And of course, from virtual reality, you're isolated from the real world. You have goggles on and you have headphones on, and you have, basically your senses are hidden. So that's really the major difference between the two. And of course, with virtual reality, there are some amazing applications. We just saw some this morning. But professional AR applications, training and education, simulations, tourism, industrial applications, theme park immersion experience, gaming and related cinematics, huge. That's going to be the driving force for virtual reality, I believe. But scripted entertainment storytelling, nonlinear and linear. I don't mean interactive when I say nonlinear. I'm just saying that it doesn't go chronologically. But scripted entertainment storytelling and performance art, really, that is what the consumer electronics industry is striving for, because that's what's going to really drive the equipment and the headsets. And really, that's their biggest dilemma right now, because there really isn't a great deal of content. And I'm talking, again, in terms of basic storytelling, linear storytelling. I'm talking about linear storytelling. And right now, when 3D came out, there were two types of glasses. There were LCD automatic ones, or circular polarized ones. That was it. Well, right now, there are probably about 50 different virtual reality headsets that are out there, including Google Glass. In terms of augmented reality, we're still waiting for some good opticals, but you don't really even need opticals for augmented reality today. All you need is any iOS or Android mobile device, and you have augmented reality today. It's this kind of stuff, and camera manufacturers are fully engaged. Everybody and their sister has a 360-degree camera, and they're using them for various things. Jaunt is using it for live shoots of basketball games and that sort of thing. But in Hollywood, they're actually trying to use these things to create storytelling, to create movies. And, a director, they don't call him a director for nothing. I mean, they're directors because they direct. And they direct not only the scenes, but they also direct what they want the audience to see and how they should see it. It's their interpretation of the script. So here we are today. Forget everything you've ever thought about movie making. Virtual reality is the new future of storytelling. And I like this because it really shows to me how isolated this thing is. So with VR, you might be a ghost observer in a story. You might be a participant in a story. You might be the story. Like The Martian. You might find yourself on Mars, and you're going to have to find your way out, and whatever. Hollywood is only now trying to figure out what works and what doesn't work. And everybody is talking about it. Everybody is doing it. They're so obsessed about it. And what they're finding out, for the most part, linear storytelling doesn't really work. We're not saying that storytelling can't work. It's just that storytelling for virtual reality is going to be something totally different than anything we can imagine today, if it exists at all. An example of virtual reality today, if you went to the Robert Redford Sundance. You went to Sundance this year. There were 30 virtual reality films, but they weren't really films. They were experiences. They were experiences that had sort of the same theme. You're a recruit who has to go through this gauntlet of scary stuff in order to become, become a successful recruit for whatever you're supposed to be a recruit for. They don't really tell you. So this guy right here, he's got a, whoops. So this guy here, you're going to see in the corner, he's wearing a virtual reality headset, and you're actually able to see what he's seeing. I'm not going to go through the whole thing. I just wanted to show you an example of the kind of thing that you would normally see.
They think we are playing Insurgents, shattered reality from the virtual reality audience.
So anyway, he's brought into this room, typical room, where they tell him what his mission is.
I disagree.
As you can see, as he moves his head,
Remove me, sister.
this is what he's seeing.
Yes. Oh, I forgot. It's been a while since I've seen the movie. I gotta pass the test to prove.
So this makes you feel like you're actually part of it. You can
Oh,
just
God,
goes into
this
your
is so
body.
weird. Oh, that's my body. That's my body. Whoa!
And he's taken somewhere else.
Oh my God, guys! This is so cool! Oh my God! Oh my Lord! I wish you guys could see what I'm seeing right now!
So, another one of my own turns out to be.
You can see this on YouTube. It's called being hit by a train or something like that. And then he gets taken out of this environment.
Very smart. You're a pretty smart guy. And the fact that it looked like you were actually in front of me. Oh, Shabbat! Oh my God! Guys, I cannot explain the feeling that's going on in my body right now. Oh, man.
And the final installment here, he actually
It's not gonna
gets hit by a train.
It's not gonna hurt! Ah!
Okay, so it's a theme park ride. That's what it is. It's a theme park ride, and that's pretty much the way a lot of these experiences begin and end. There is no storyline. There is a way of doing. Now you notice that he had to be carried around. He basically had to be moved around. because he couldn't walk, he'd be, trip over himself because he can't see anything, right? Well, the void is something that it's a 60 by 60 foot area, and what it is you wear your VR equipment, but they've got walls all over the place, and the walls they're basically plaster walls, and what happens is the computer generated worlds are mapped onto the walls so that you can actually walk around and feel things and do things. Give you an example of it. Love demos, don't you? Especially when they're a little bit too good to be true. No, I mean, they actually have these centers and they're building them all over the place, but it's a gaming experience and it's 20 minutes long. I don't know too many gamers that can do a first-person shooter game for 20 minutes and be satisfied. It costs $30 and you can only do 8 people at a time. And so, it could it could be successful. I met with the CEO and I said, you really have something here if you can bring it into the home. Yes. But that's not really what you want to do. This is all exciting stuff. However, there are many in Hollywood whispering. And I say whispering because a lot of them, most people don't want to down the latest and greatest new technology because they want jobs. Right? So, except for gaming and cinematics related to gaming, could fully immersive VR storytelling be over before it begins? People are saying that. People are wondering. And with valid reason, the audiences accept it. I mean, can you monetize this thing? Can you create movies? Can you create stories that are long enough, yet short enough, so that somebody can wear one of these headsets for a period of time? There's no doubt that VR has a good, bright future in gaming. We know that, but there are many who doubt that it can be used for storytelling today. And some of these people are very significant. Jim Cameron said that Oculus Rift was a yawn. He was totally unimpressed. Ed Catmull, who is co-founder of Pixar Animation, doesn't feel it's useful. It can be used for storytelling. George Lucas and Robert Redford at Sundance this year basically said, yeah, we saw all those films, and there's all the pieces in it. There's visual effects and all of that. There's no story. So they're recognizing it. So a lot of more significant industry people are questioning. But again, as techies, we get wrapped into our own technology. We get into a bubble. And a lot of people are swearing by virtual reality. But you know, last week I saw these headlines. You know, they're reducing their projections by 30%, and they're finding that most people outside of our techie bubble really aren't interested in virtual reality. So again, Hollywood and consumer electronics industry, which went crazy with virtual reality this year, the smart money from Silicon Valley. I think right now, in terms of virtual reality, right about here. Maybe just over the slope a little bit, okay? But you know, the lemming metaphor is really, really working because 2010, again, it was unbelievable in terms of virtual reality at the Consumer Electronics Show, just like 3D was in 2010. For virtual reality, I believe, personally, the moment of truth would be CES, Consumer Electronics Show 2017. Why? Because by then, there will either be an example of what a story can be, or they won't. And Spielberg, by the way, is trying to do some episodic stuff. And it's got to be episodic because nobody can wear these things for more than 5 minutes. You know, they get sick or sweaty. So he's been trying to do it. And maybe he'll succeed. I don't know. But for augmented reality, I think the potential for entertainment and storytelling outside of gaming are only now being explored. I think there's a lot of potential. Let me show you something from the HoloLens. All right, again, this is games, but let me show you what is possible within our reality and what we can actually produce within our reality rather than virtual reality. Sorry about the jerkiness of this.
Thanks, Terry. Today, we're excited to show you mixed reality gaming on HoloLens. Specifically, how HoloLens can turn every room of your house into a personalized video game level. Now, to do that, we're going to be showing you a game codenamed Project X-Ray.
This
we
is
also
the
have
boy
this custom camera that can
brought
see
to the
a view
home.
of every hologram. Dan sees all the holograms he's looking at, but this camera will show you all of the action on stage. Now, Project X-Ray is a game that can be played in any room, but today Dan's going to be playing it here, and you're going to see him defend this stage from a mixed reality robot invasion. Previously, we've shown you how HoloLens can place amazing holograms in your world, and how those holograms can interact with the environment around you. But today, we want to take mixed reality one step further. So we've got something new to show you. Holograms you can hold. This holographic gauntlet is the weapon that Dan will be using while playing Project X-Ray. You'll notice that as he moves his arm, the hologram moves as well. This is a wearable hologram. And when you combine technology like this with the environment understanding of HoloLens, you can do some pretty spectacular things. Nice. All right, let's battle some robots. With HoloLens, you're completely untethered, which means Dan is free to move around as he shoots at enemies and avoids their fire. With HoloLens, the action happens all around you. And thanks to spatial sound, you'll hear the gameplay as though it's happening in your room. You'll notice that the robots know where the walls and the furniture are, and they can use that knowledge to navigate and plan attacks against you. Since each room is unique, every game is customized to you. That didn't work. What else you got?
Vortex mode.
Holograms behave just like real objects. They can interact with the environment and with each other. For larger enemies with more powerful weapons, Dan can even use his shield to defend himself. Nicely done. Looks like that's all of them. We hope you enjoy Project X-Ray and mixed reality gaming on HoloLens. But that's just a taste, because with mixed reality entertainment, you never know what's around the corner.
Love demos, don't you? This is real, except for the fact that HoloLens has a very restricted field of view. So you're not going to see it quite like that, but all of that is actually real. You can actually do that. Now the interesting thing is you've got a company called Magic Leap, which just raised, altogether it's raised $1.4 billion to create something better than what you just saw. But all we've ever seen from Magic Leap are demos. And the demos are basically, I'm just going to go ahead, it's basically the same sort of thing. The demos are created by Weta, visual effects company in New Zealand. It's the same sort of thing, exactly the same sort of thing. The thing is, for $1.4 billion, they better come out with something that's affordable, and they better come out with something that's a lot better than this. Because, frankly, it's not much better than HoloLens, right? So anyway, that's where things sort of stand in terms of optics for augmented reality. Now, but there are some very exciting things that are around the corner for augmented reality. I don't know how many people have heard about the holograms with Tupac, right? And Michael Jackson in Vegas. I mean, neither of these guys are alive, but they're performing. And they're performing, and Tupac is performing with Snoop Dogg. But the thing is that these are not really holograms. They're actually, it's a parlor trick. It's called Pepper's Ghost. And all it is a projector that goes down to a reflective surface and then reflects onto a mylar sheet that's transparent. All right? It's still augmented reality, isn't it? But this was invented, or not invented, became popular in 1862. And it's been around for about 300 years, believe it or not. It's just a parlor trick. But if this is driving audiences crazy, and people can monetize this, then augmented reality should be able to find success if they can create real characters, real performing characters. I'm going to show you a company that's doing it.
You have to keep inventing it. You have to keep showing people.
He's not real.
Why you're here. It's about who's going to rock the spot tonight.
As the internet transitions to 3D,
This is 3D scanning
to create an experience
of people,
in this new digital reality.
to create a CG, computer graphic image of
people into truly immersive 3D
in
experiences
full motion.
for virtual reality, augmented reality, and the web. For the first time, you can move around them and experience a real emotional connection.
This is for virtual reality and augmented reality. It's a guy holding this in.
Connect with each other in the closest way to real life.
Just want a video for you to see when you're grown and you have your own family.
Where you're not just watching someone, you're looking at them.
When you're looking at something created in AI, it's that eye contact that you make with an individual, you're able to see the facial expressions. There's an authenticity to it.
And they're going to become part of us that we leave behind.
You can literally be anywhere. It's no longer restricted space. It's effectively infinite space.
So what I'm looking at is something like, I wanted to point this out. Yes, this is possible. You can do this today. That guy was actually juggling in their hands. But this is something that came out 2011, believe it or not. It's a promotion from Kit Kat, right? And it's augmented reality, and it's seen through a webcam. But we shouldn't be seeing flat characters there. We should be seeing the kind of people we just saw that were created in CG. Entertainment can happen in augmented reality. Now, there's also location-based AR storytelling that's also been around since 2011, believe it or not. And this is kind of interesting because this is something that actually I've been working on, something similar to this.
In 2011, NBC Universal launched the new, even more thrilling 13th Street Universal. The challenge? Get the audience engaged in the genre of thriller and crime like never before.
Ich bin Nadia Rova. Wenn du das hier siehst, sind wir und ich wahrscheinlich tot.
The solution? The Witness. The first movie in the Internet. On our website, viewers all over Germany applied to be part of this exclusive event. The winners begin at a hotel in Berlin. The mission? They have to save Nadia, a prostitute from the Russian mafia. With GPS and a special software we developed for the iPhone, viewers can experience a real-life film directly at the crime scene. Everything begins when Nadia is kidnapped.
Das Material, Nadia. Das Material.
Now the viewers have to take action. Suddenly they are a part of their very own thriller in an interactive mix of movie and live game.
Bitte hilf uns, das Beweismaterial hinzustellen. Du bist unsere letzte Hoffnung.
The search for Nadia will take the viewers on a journey all over Berlin. They have to navigate their way through various locations and make crucial decisions. The smartphone becomes a key essential tool in order to stay in the game. Viewers cannot witness the action passively. They have to collect evidence and data and communicate with their opponents. The viewers need to overcome their fear and constantly be aware of Nadia's kidnappers.
Sie muss mir schnell weg. Steigen Sie ein.
Borders between reality and fiction dissolve completely. Actors from film appear unexpectedly. They can be an ally or an enemy. It's a battle against time, and depending on the decisions, one can be the hero of the film
Aber Sie hätten mir nicht vertraut.
or the next fatal victim of the Russian mafia. By the way,
I was thinking of something a little bit simpler than that. We have friends. I have a friend who does a one-woman show. She's really great. On the stage for an hour and a half, and she tells funny anecdotes about her family and everything like that. She's really very, very good. So you picture going to Lagardere and having a glass of wine, and putting up your iPad, and you see somebody sitting over in an augmented reality form 10 feet away from you, and it's her. And she's having wine. And all of a sudden she comes out of her body and starts performing in front of her. Or possibly even goes around to the other side of the table and starts talking to herself about, different things. So you can actually create a narrative story, short story, episodic story in that form, where you don't have to go all over Paris or all over Germany. So there are ways of doing it that could be very, very, very innovative. In terms of this thing, let me just show you real quick. This thing here, this was, I think in New York. You stand here and there's a big screen up that you're looking at, and in the screen you see yourself with these raptors that are playing around you. This thing here, this happened at Augmented World Expo, and this is real. Here I am, and this zombie is walking by me. Of course, I can't see him because I don't have any glasses or anything, but he was in this phone booth, frantically trying to get out, and he smashes out, and then he walks past me, and the person with the iPad is the one who actually saw him walk past me, and he took this picture. So that was actually real. And of course, outside, if you saw Octagon Studios, they've got some amazing cards that have animated characters. If you can do this, you can do performance art, you can do storytelling in augmented reality, I believe. So the bottom line is, I think at the end of the day, augmented reality is going to become the big player in entertainment and in many other aspects of our lives. It's already part of our lives. Football games, you know, all of the markers are all augmented reality on the field. Heads-up displays are happening everywhere. Virtual reality is going to be significant, but it's going to be significant, I think, with a more limited demographic. So, as I said, you're going to hear, I told you you're going to hear something here that you wouldn't normally hear at a conference or anything like that, because typically everything is coming up roses at conferences about virtual reality and augmented reality, and I'm giving you a different perspective. So the conclusion, I think the data storytelling is not going to change anytime soon. There'll always be a majority of audiences that do not want to be 100% immersed. They want to be told a story. And VR will not likely be a storytelling medium outside of gaming and cinematics associated with games. What I mean by that is there are cinematics around all games, and some of them very good. It's like Blizzard Entertainment has beautiful, really feature film quality cinematics, and gamers like that, and they can handle it. Gamers love that kind of stuff. So augmented reality, I think, is the best opportunity for attracting audiences to enhance narrative storytelling, and I think that's the message I want to leave you with today. Thank you.
Thank you, Barry. From the audience, anyone has questions? Jurgen?
So I was wondering, so you were talking about films that you converted from 2D to 3D, and I was surprised to see, or I mean, I kind of knew it, but I never thought about it, is that there's still films made in 2D that then immediately are given to you, or to Legend 3D, to convert to 3D. What are the reasons? So my first part of the question is, what are the reasons why this is happening, even though they could have shot them in 3D right away? And then the second part is, would this maybe be a model to take 2D, to keep filming in 2D and turning that into virtual reality experiences instead of just turning them into 3D films?
Well, actually, conversion is, there were people who would kill me for saying this, but I can prove it. Conversion is higher quality than shooting with two cameras. Because remember, I take one image, I create a left and a right eye. If you wanted to shoot, if I wanted to shoot this room right here, this is a distance where there is a good deal of stereo. My eyes are 62 millimeters apart, and that's going to give me a sense of what real 3D looks like. If I wanted to do that with a set of cameras, you can't get those huge cameras together close enough, 62 millimeters, so it can look normal. So the way they do it is they build a rig. One camera is pointing straight out at you guys, right? But it's looking through a polarized mirror here, all right? And the other camera is straight down. So you can see that if it's straight down, you can move it so that the lenses can even overlap, right? So that's how you get to 62 millimeters, right? So nothing about those two cameras are identical. The sensors are different, the lenses are different. The mirror is of less optical quality than the lenses that you're using. And not only that, but you're looking at through a polarized mirror, and you're looking at a reflection off the mirror. So that means one eye is getting a polarized image. That means that if there's a puddle in a movie, and you're looking at it, and they don't correct it, they found ways of correcting it now, you'll see it's kind of weird. There's something strange to it because of the polarization. But when I take one image and I create a left and a right eye, every single pixel in those two eyes are identical in every single parameter except for the disparity that I put in creatively. Now, with two cameras, you can't do most of the stuff that I showed about polarized would be impossible. You can't do that. Because once you shot it, you're done, right, for the most part. So conversion allows the director to take a lot of creative liberty and really be more creative about the product that they're building. So you're talking about also about.
And then my other part was, could you use what was learned from turning 2D into 3D films to turn 2D films into virtual reality experiences?
Jared Murray.
He does that.
Jared actually, it's okay. Jared actually, they did a Patron commercial. Patron tequila commercial. They shot it using a drone and a GoPro rig. And they shot it from the fields all the way through the whole process up to a black tie event where you see the Patron. It was all shot in 2D. And then what Jared did was he converted it to 3D. So it was much more efficient to do it that way and much higher quality. Didn't need you.
Sorry, Jared.
So actually, if I was to follow up question, just around the economics of converting versus.
Oh yeah.
Right.
First of all, it doesn't take as long. It's cheaper. It is cheaper to do it. It takes an army of people to do it. It takes hundreds of people to do a feature film because, again, it's all handwork for the most part. But the studios don't like to mix, shooting and conversion. They just like one process. And if you're going to do something that's heavy visual effects, if you shoot with two cameras, you have to take the visual effect that the visual effects houses turned into 3D, and you have to composite that into the left and the right eye. And if you're off by a single pixel, it creates something called ocular rivalry, which is you only see it in one eye, and if you see something that's big in one eye and not the other, you go, oh my God, you can't stand it, and you just simply can't look at it. So it's much more difficult for an artist, a visual effects artist, to composite visual effects if you have two eyes. With a conversion process, you convert everything, in one frame, and then you convert it afterward. So it's much easier and higher quality. Yeah.
How long did it take to come to cameras that can take from a single lens and split into two images 62 millimeters apart?
How long does it take to convert?
How long it would take for someone to design that kind of camera? What do you think? People are developing those kinds of cameras right now? Because it's a known problem, as you were mentioning.
The cameras have not improved, but the post-production has improved. The cameras are still exactly the way I told you they are, because you can't make them any other way right now. They're just too big, and the lenses are too big. You simply can't do it. So all the flaws that I mentioned in terms of a over-under rig, we call it, or a beam splitter rig, are still there. But in post-production, they found ways of getting rid of all of the artifacts and trying to make it better. But if I see a movie that's shot in 3D, typically I can tell it was shot in 3D, not converted, from the artifacts, from the things that are wrong. Any other questions? Yeah.
Besides the movie you worked on, what are your favorite 3D movies? Maybe like the top five.
I have three. I have three. One is Coraline. Coraline is a stop motion, which is probably my favorite movie entirely. I mean, people should see it. But if you ever buy Coraline and you have a 3D television, I have a 3D television, watch the making of it first. And normally you want to watch the making of it last. No, watch the making of it first because it's pretty damn amazing. Then there's Gravity, and then there's The Walk. And I think one of the reasons why The Walk is so good is because it was absolutely made for 3D. The way that Bob Zemeckis put that movie together, it couldn't be done in any other way than 3D. Seriously, I mean, you're up on top of the World Trade Centers, and you're looking down. You're looking at this guy, and it's just so masterfully done. And what Jared did, won Creative Award from the Advanced Imaging Society for his work on that movie, which he did in concert with, and we worked directly with Bob Zemeckis, and it's been getting rave reviews. There's one other movie that I like, and it's a documentary actually. It's called Enchanted Kingdom, and that's a movie you really should see. It's by BBC Earth, and to me it's eye candy. I don't even have to listen to it. I just want to watch it because the filmography is so beautiful and the stereo is so well done. We did about 30 minutes of it. In 30 minutes are, zooms of alligators and crocodiles rather. And because if you have a zoom lens, there is no stereo in the zoom lens, and so you have to actually create it. So whenever there was a macro shot or a zoom lens shot, which were many of them, because they had the photographers had to hide. It took about 550 days to actually shoot that movie. And so it took a long time. And so they had to use zoom lenses, and the only way to make that 3D is to convert it. Is that it? Okay. Well, thank you, people.
Thank you, Barry. Wasn't this amazing? I'm sure you enjoyed the talk by Barry, also from Jurgen Schulze and Barry Sandrew, and Dr. Ortiz has already left. But I wanted to give a small token of thanks from TiE. Barry, thank you. Jurgen, thanks. And where's Jared?
He's outside.
Okay, oh, there he is. Thank you. I also wanted to thank the hotel and hotel management. They did an amazing job. They worked very hard to put this together. Give them a big hand. And we'll continue to do these type of events. And I think, this was a premier event, and I think we had excellent demos. I think Barry was instrumental in organizing this, and thanks a lot, Barry. Really appreciate it. With that, we conclude our today's event. Thank you. Thank you all.